Results. After the first round of independent labeling by the two oculoplastic surgeons, the agreement rate was 82%. The remaining images with disagreement were then resolved as per the study protocol. Following the test protocol, a total of 22 separate CNNs was trained. For each of these models, the accuracy score was calculated by testing the model against the test image dataset. As seen in Table 3, there is a significant variation in accuracy seen between the models. The pre-trained models had an average accuracy of 82.6%, and the models without pre-training had an average accuracy of 85.8%, with no significant difference between the two groups. A notable advantage of utilizing models with pre-training was that the time taken to take each model was significantly lower at 1 minute versus 16 minutes. 这边前面讲的是说有2名医生会对照片进行标记，那2名医生标记结果相同的趴数大概是82%。那这一面讲的是说总共呢有22个模型，那如果分成2组的话，可以分成有事先进行训练的一组，跟没有进行事前训练的一组模型。那这2组呢，有训练的模型，它们的正确率平均大概是在 82.6%， 那没有进行训练的模型，它的平均正确率是 85.8%， 但是这2组呢，并没有统计上显著的差异。那但是呢，它的有事前训练，它的一个好处就是在进行模型分析的时候，它花费的时间会比没有进行训练的还要来得好。那比是这样子1分钟跟16分钟的差距。这张表格就可以表示前面前文所讲的内容。那左边这一栏就是有事前进行训练的模型，那右边这一栏就是没有事前进行训练的模型。那这边 ResNet 18这边的正确率是 88.6%， 那 DenseNet 121它这边的正确率一样也是 88.6%， 都是最高的。Rather than present detailed score for all 22 models, we chose to calculate scores for the best and worst performing models. This was done to provide a contrast overview of range of model performances. ResNet 18 without pre-training also had the same results as DenseNet 121 without pre-training. We chose to include only one best performing model. For simplicity and clarity of findings, DenseNet 121 with pre-training was chosen as the best model, as larger models tend to generalize to unseen data more accurately. The best performing model achieved a sensitivity of 90.3% with a specificity of 82.4%, which was significantly better than the worst performing model, which achieved a sensitivity of 74.1% and specificity of 63.6%。那表示同样可以表达前面2张投影片做个简约的整理。那前面有讲到说 DenseNet 121跟 ResNet 18有相同的正确性，但是 DenseNet 121它是一个比较大的模型，所以会选择它来当做最好的模型。那这边 ResNet 34就相对是最差的模型。那最好的模型呢，它的敏感度是 90.1%， 然后特异度是 82.4%。那最差的模型呢，这边它是敏感度是 74.1%， 特异度则是 63.6%。This is demonstrated well in the confusion matrices, revealing a far higher rate of false positives and false negatives in the worst performing model. The AUROC and F1 scores also reflect these differences in model performance. 那 透过这个图呢，就可以表达前面所想要表达的 confusion matrix， 就是误差矩阵。那这边可以看到说，它这边是最差的模型，那这边是最好的模型。那可以看到它的伪阳性跟伪阴性都会比这个最好的模型还要来得高。那这边是 true labels， 就是医生他们所标记的结果。那横轴呢，则是就是模型跑出来的结果。那这样子可以看到这两个矩阵，它们两个模型之间的差异。Discussion. Blepharoptosis is a frequent cause of peripheral vision loss, which typically requires surgical intervention when significant. The accurate diagnosis of blepharoptosis is complex and relies heavily on accurate MRD1 measurement in traditional clinical assessment. Studies have found MRD1 to be the most predictive measurement of visual field loss. However, accurate measurement of MRD1 by non-expert clinicians is known to be suboptimal. 这边是在讲说眼睑下垂的问题呢，会影响到患者他的视力。那明显的时候呢，会需要这个手术的介入。那传统的诊断方式是透过这个 MRD1 measurement 这个测量的方式，但是这个方式呢，在没有专家的操作下是很难进行的。To facilitate accurate diagnosis by non-experts, we present the first publication demonstrating an AI algorithm to accurately and reliably diagnose blepharoptosis from a single photo, without the need for external reference markers or manual annotation. We also explore various CNN architectures for this task and found many models that had reasonable performance, with the best models reaching a sensitivity of 19.1% and specificity of 82.4% on a previously unseen test dataset. 这边讲到说，为了优化那个 AI 的演算法，让它可以在不需要专家的手动标记或者是介入下，也可以正确的判断出这个患者他是不是有眼睑下垂的问题。那这边同样又再讲了一下，就是研究结果上最好的模型，它有敏感度90.1% 跟特异度82.4%。Several experiments were performed during the construction of our AI algorithm to help determine which architectures would lead to the best results in our particular task. Transfer learning and large models are known to be effective in many medical image recognition tasks. However, our dataset differs in that there is limited variation in our images, and our dataset is relatively small. 我们透过这个研究呢，可以得到最好的演算法。那这边也讨论到了说，迁移学习呢跟大型的模型，它可以影响到这个医学图像的辨认。但是我们这个研究呢比较不一样的是，因为我们的每一张图片之间的差异非常的细微，并且样本数是比较少的。Transfer learning is a technique that is designed to enhance the performance of a neural network by pre-training the network on a large dataset that may not be related to the intended use. This allows the model to learn general features of images, which can then be applied to the target image set. 这边解释了一下迁移学习它的意思，就是先让神经网络呢，它进行大样本的训练，再事先进行大样本的训练，这样子呢，可以在它进行新的图片的辨认的时候更为顺利。Tested some of the leading CNN architectures with and without pre-training, and found that the DenseNet and the ResNet architectures without pre-training provided the best performance. A number of the other architectures also performed quite well. In our study, we found that models without pre-training and those with pre-training had similar performance. Typically, pre-trained models have better performance as they have already learned many common shapes and image patterns, which makes it easier for them to deal with a wide variety of image recognition tasks. 这里讲到我们刚刚的研究结果有说到，有事先进行训练的模型跟没有事先进行训练的模型，它们的结果其实是差不多的。但是理论上，有我们前面几张投影片有讲过的话，理论上有事先进行训练的模型，它其实应该要有比较好的表现。那因为它之前就有训练过很多的图片，很多的样本，所以应该他们要有比较好的结果。However, the author hypothesized the limited benefit in this scenario may be due to limited variation in ocular photos usefulness. The use of the pre-trained network did, however, significantly reduce the training time for the models. The complexity of the architectures also had a limited impact, with the 18-layer ResNet 18 performing similarly to the 121-layer DenseNet 1-to-1 architecture. The authors believe this is also due to the relatively lack of variation in eyelid images, and thus the number of layers and widths needed for an accurate model is fewer for this particular task. 这边讲到说，为什么理论上其实受过训练的模型，它应该要比没有受到训练的模型来的结果要好，但是我们的研究结果却是不是如此的。那这边的作者呢，他假设原因是因为其实每一张图片它们之间的差异是非常细微的。那这边也讲到，前面也有说到，比较大型的模型呢，它可能也是可以比较好的分辨图片。那这边理论上也是121层的 DenseNet 1-to-1 跟18层的 ResNet 18，其实应该是要 DenseNet 会比 ResNet 还要好，但是这边研究结果也是他们的正确率其实是一样的。那我们把它的作者也是把它的原因归纳在说，照片之间的差异性是非常细微的，所以才会有这种问题。那他们也推论出，如果要有需要正确的模型呢，其实是不需要这么大的模型。Previous reports investigating automated blepharoptosis detection from facial photos have relied on traditional computer vision processing methodologies. The relative contrast between the eyelid versus scleral iris does make this task possible under most circumstances, as it is possible to handcraft these features. However, these techniques tend to fail when lighting is suboptimal, or the lid contours do not fit the expected parameters, thus leading to failure in challenging situations. Furthermore, specifically created computer vision techniques are limited to exactly what features are hand-coded initially, which limits the scope of their ability. For example, cases of severe dermatochalasis could not be differentiated from true blepharoptosis through these algorithms. Some techniques require hand annotation of images by the user, and others require a reference marker to be placed on the patient before the image is taken. This usually takes the form of a sticker of pre-specified dimensions being placed on the patient's forehead before photos are taken. Requiring hand annotation of images takes a significant amount of time, and it is not practical to expect a busy clinician to annotate these photos when the software is being used at the point of care. For images where a reference marker is required, this also poses issues to clinical workflow, as clinicians must obtain the reference marker of appropriate size for that particular software, then have the reference markers available at all times, which can be limiting. For example, When reviewing a patient who is unwell in a hospital bed and unable to come to the eye clinic, both of these methodologies thus have challenges to their implementation in a real-world clinic context. By utilizing a CNN architecture, we have shown that it is possible to identify ptosis in a variety of clinic settings, without any extra step required from clinicians which may disrupt existing clinical workflows. 前面这3章讲到说，传统的方式呢是通过电脑呢测量眼皮跟巩膜还有虹膜之间的距离，来确定说这个患者是不是有眼睑下垂的问题。但是这个方法呢，虽然大多数时间是适用的，但很容易受到光线等等其他因素的干扰。那它而且并不是很精确，有时候它可能很容易跟眼皮下垂和眼睑下垂来互相混淆，所以没办法很精确的进行诊断。那传统的方式呢，常常会需要用到手动标注，就是专业人员需要进行手动标注，然后有时候呢也会需要在患者或者是在拍照之前，在患者的额头上面贴一些标签来进行一些标记，以利这种模型来进行判断。但是手动标注其实是蛮费时间的，并且医护人员在进行其他的照护工作的时候，其实是会打乱医疗流程。那患者贴标签，在患者的额头上面贴标签呢，其实也常常需要考虑到这些贴纸的大小什么之类的，也会造成医疗流程上面的不便。那这一章就举例到说，像是如果病患呢，他状况不好，需要卧病在床，他没办法到眼科进行诊断的时候，在实际上这些传统的方式就会受到一些挑战。那但是如果用这种 CNN architecture 就会比较方便，而且也不需要就是专家的介入。It is important to know some limitations to this study. Firstly, our dataset has a relatively small number of images compared to the typical numbers of images used in AI image studies. This, however, reflects the difficulty of acquiring images in a subspecialty field, especially considering the sensitivity of the original clinical images, full-face images. For this study, we chose to exclude patients with severe dermatochalysis, upper eyelid retraction, and poor image quality. 这边讲到研究的限制，那第一点就是样本数是比较小的，而且我们也把比如说眼皮下垂的样本去掉，然后里面也有眼皮内缩的样本也去掉，还有一些图片模糊不清的也把它去掉。那可以了解到这种图片性的资料，还有这种全脸的资料其实是较难取得的。The source images were from patients who were given a ptosis diagnosis at some stage, though the images from each eye of all patients were separated and independently assessed by a consensus of oculoplastic surgeons to ascertain our ground truth levels. This early study was designed to establish the possibility of creating an AI algorithm to identify ptosis, and as such the image set was relatively simple. Furthermore, the image set consists of patients only from an Asian ethnic background, which limits the applicability of these findings to other ethnic groups given differences in eyelid features between populations. These are both issues we aim to address in future studies utilizing a larger dataset. We believe that a larger dataset including a more diverse range of photos will allow a more accurate model to be developed. Firstly, by having a larger dataset, we will be able to further optimize model hyperparameters. In our paper, we chose not to attempt further hyperparameter optimo- opt- optimization beyond what has been described in the methodology of this paper. Due to the relatively small size of our dataset, having a larger range of clinical examples for different populations will also help the model be able to train across a larger set of examples and ultimately perform better when generalizing to other patients. 前面就有讲到说，因为我们的病患呢，其实全部都是来自于不同阶段的眼睑下垂的病患，所以样本的来源相对于简单，并且我们的这间医院就是几乎都是亚洲人当做样本，所以样本的多样性是比较不足的，所以未来说加大样本数，还有增加样本的多样性是未来的目标。Even amongst experts, there can be some subjectivity in the diagnosis of ptosis, especially when making judgments from an isolated clinical photo. As such, we sought to have a consensus agreement between oculoplastic surgeons to try and increase the accuracy of ground truth labels and feel that expert opinion is a reasonable method of classification in this situation. Finally, with regards to the choice of model, it is often impossible to predict which model will perform best on a particular dataset. As such, we experimented with numerous different model types, potentially introducing an element of chance into model selection. We hope that future studies will be able to reference this study to have a more in-depth understanding of how different models perform on oculoplastic images and guide their model choices for study. 这边讲到说，专业人士呢，他们其实还是免不了有主观意见。那尤其是在对着一张单独的照片，只有眼睛的照片，那更容易有主观的感觉。所以呢，他们还是有在第二轮的时候有讲到说，他们会进行意见整合，来降低它这种偏差的问题。那第二个有讲到说，我们完全无法预测说哪一个模型是可以最好的判断患者有没有眼睑下垂的问题。那所以我们这个研究呢，就是进行了很多模型的测试。那希望未来的研究可以参考这篇文献，然后进行一个更深入的研究。To further validate our findings and fine-tune our algorithm, a multi-center prospective trial is underway to build a larger dataset with a broader set of eyelid pathologies and validate our algorithm against external datasets and the diagnosis of other non-expert physicians. Finally, all photos taken for this study are formal clinical photos taken as part of clinical care. As such, the quality of these images is likely to be of a higher caliber than images taken by primary care physicians or patients. To help account for this, our model was trained with data augmentation to vary the lighting and imaging quality, which helps improve the generalizability of our model results. In future studies, we aim to capture images from a wider variety of devices. Further studies are also warranted to explore additional applications of AI in oculoplastic and eyelid evaluation. By utilizing a larger dataset, we propose moving beyond binary classification to a multi-level classification of eyelid position, exploring degrees of blepharoptosis, and diagnosing other eyelid pathologies, such as the metal chalices, eyelid retraction, or eyelid malposition, Our long-term vision is to incorporate these tools into a clinically validating decision support tool that can be used in a variety of settings. For primary care physicians and ER physicians, it can offer a convenient way to assess patients with suspected ptosis, either in the context of suspected systematic neurologic disease or to facilitate referral to an oculoplastic surgeon. For ophthalmologists, it also conveniently labels photo documentation, with the potential to replace manual MRD1 measurements and visual field testing for insurance approvals. 这边讲到未来可以前进的方向，那我们这篇研究呢，它的照片来源其实都是正式的临床照片，所以跟一些第一线医生他们拍的照片，或者是患者自己拍的照片，那个质量当然是不一样的。那之后的方向可以透过调整其他的光线，或者是调整图片的质量，让这个模型可以有更快的适应这样子。那我们也希望我们的模型呢，它除了像这一次的研究这样子，只能分二元的，像是有没有眼睑下垂以外，还可以有多种程度，比如说下垂到什么程度，或者是也可以诊断出其他的眼睛方面的问题，比如说眼皮下垂啊，或者是眼皮内缩，或者是眼皮错位这些的问题，也可以进行诊断，是希望未来可以努力的方向。那如果说这个技术可以获得落实的话，对于第一线的医生呢，或者是急诊的医生呢，他们评估疑似有这种眼睑下垂的个案会更顺利，或者是在需要转诊的时候也会更明确。那对于眼科医生来说呢，这项技术呢，说不定可以替代这个 MRD1 的测量方式，或者是他在做诊断的时候也可以更有保障。Conclusion. This paper demonstrates that an AI algorithm utilizing CNNs can detect patients with blepharoptosis with a high degree of accuracy, without manual user annotation or the need for reference markers on the patient. We explore a variety of CNN architectures and found that most leading architectures had reasonable performance on this task. With the DenseNet 121 and ResNet 18 architectures achieving the highest accuracy. Pre-trained models had similar performance to non-pre-trained models, though model training time was significantly lower for pre-trained models. Our findings form a foundation for future research applying AI in oculoplastic by demonstrating the possibility of accurate model creation and guiding CNN architecture selection in this subspecialty. We believe that through the use of a larger, more diverse dataset, future studies will be able to create an AI algorithm with increased accuracy. 这边总结了一次，就是这篇研究呢，它证实了说，使用 AI 演算法呢，它可以有效的判断这个患者他有没有罹患这个眼睑下垂的问题。那也不需要使用手动标记啊，或者是在患者的额头上面贴标记，这两类都不需要，就是单用 AI 演算法就可以知道它有没有。那这边也讲到说DenseNet 121跟 ResNet 18，它们达到了最高的正确性。那总共22组 model 里面呢，有进行事先训练的跟没有进行事先训练的模型呢，它们其实是有差不多的结果。那只是有进行事先训练的模型，它耗时比较少这样子。那文章最后也讲到说，如果未来的研究呢，可以用较大的样本，那它的正确性一定可以较高。